Well, we'll take you live now to Brisbane, where Deputy Queensland Premier Stephen Miles and the Chief Health Officer, Dr John Gerrard, are speaking after visiting a pop-up vaccination clinic.
We've been sent lots of letters that the government's received from business owners who had to isolate for 14 days. They lost a lot of money. Did all of this play into this decision making?
Look, obviously that's a consideration. The impact of every decision, its benefits and impacts are weighed, and in this case the Chief Health Officer has been able to provide the advice that, given our current risk settings and what we're seeing in terms of the incubation period of the virus, that we can relatively safely move to 7 days quarantine for close contacts.
That's been hard for those business owners who have had to isolate, no income.
It clearly has had an impact, and that's one of the matters that is considered, that is weighed by the health advisors when they provide this advice. We've obviously experienced it ourselves too. You've heard from the Police Commissioner. It has an impact on hospitals, on the ambulance service, so we understand that the impact these settings have on operations, and that's been taken into account in bringing down and bringing forward the reduction in the quarantine period for close contacts.
Diseases expert Griffin yesterday agreed with Dr Gerrard in terms of saying the day 5 paper test was not the most important thing. We've got double vax people who have already done the PCR test before they leave. So who do we believe, the Health Minister or his two learned colleagues? She says it is important. 2 weeks ago she said the important thing is this day 5 COVID test. But Ben said earlier it doesn't seem to be effective at all in terms of its enforcement, to say the least. Not one fine issued yet. Are people taking it seriously?
Oh, look, all of the measures that we have in place are based on the health advice. They all cumulatively provide the public health measures that we are currently using to manage the increase in case rates, and we'll continue to take that health advice. Currently, that health advice requires a PCR test at day 5.
It's almost impossible for people to get a test. People are waiting for 9 hours in queues. Is the Queensland border effectively closed for people who can't get their negative test before they come up?
Well, I think you're well aware it's not effectively closed. Many people are coming here. The Police Commissioner just outlined how we've issued 235,000 border passes. That is hundreds of thousands of people coming here from hotspot states. So that doesn't include people coming from states where they don't need those border passes.
Would you consider extending the 72 hours to allow people to get those negative tests?
Well, again, that would be based on the health advice, and I'm happy for you to put that question to the Chief Health Officer, but the 72 hours is based on the current experience of the incubation period of the virus.
Given cases doubling every 48 hours, sort of accepting of that, when do we get to a point where borders and checkpoints and border passes become somewhat redundant?
Well, they're doubling at that rate with all of those measures in place. So if you reduce the measures, then the doubling rate shortens. The rate of increase goes up. And so they're the measures we have in place now, and the result of those measures is a doubling rate every 2 days.
How many of the people who travel from the hotspots, ACT, New South Wales, Victoria and Queensland, had tested positive for COVID on day 5?
I don't have that data.
We asked the Chief Health Officer.
I'm not sure it gets broken down there.
No one knows.
Minister, yesterday we had reports that people being turned away for long queues at vaccination hubs, but there's no supply issues so far.
I'm not aware of any supply issues now. There's certainly no queue here at platform 3 of Roma Street Station.
Are you worried though about big crowds and people might be getting worried and rushing out to get their boosters and things?
Oh, I hope people do rush out to get their boosters and things. That's exactly what we want. The more people we can get triple vaccinated, the safer they will be from the current variant of the virus.
Dr Miles, Premier yesterday, people coming into Queensland to go and get that day 5 test. Obviously she's concerned the numbers are low, but what is the number of people who tested positive? Queensland is keen to know that, given the assurances of protection that the Premier and the Health Minister gave them 2 weeks ago when announcing the border would reopen. I think Queensland is keen to know the extent of the threat from those people who have travelled from hotspots. Is that a fair enough expectation from them?
Well, I think it's not unreasonable for Queenslanders to expect that people coming into our state meet the requirements of their border pass. You just remember that it wasn't that long ago these people couldn't come to Queensland at all. Now they can, and they are coming in their hundreds of thousands. And one of the measures we've put in place to keep Queenslanders safe is that PCR test.
It's reasonable though to know the effectiveness of those measures, isn't it?
It's reasonable to know that we've put them in place. It's reasonable to know that we've put them in place based on the health advice, and we'll continue to take the health advice.
You can't provide any reassurance, by the way, of the number of positive tests from those people travelling.
We don't break those tests down that way, but I know that many people are getting their day 5 test. I got a COVID test on Saturday, and the person in the queue next to me was getting their day 5 test. They come from Sydney.
Just anecdotal stuff.
Same as yours. Anyone else? Thank you.
And that's where we will leave the Queensland press conference. There are things you need to know. 86 new cases. Big change there to close contacts. Rather than the 14 days, that will now be reduced to 7 days quarantine. But the key caveat is that is only for the double vaccinated.